Patient safety. Clostridium difficile, C-Diff, is no walk in the park. The nurse to-do list. Check patient's vitals and do the assessment. If patient has symptoms such as fever, loose stool, and malaise, notify the doctor and isolate the patient as soon as possible. Once the doctor writes an order to collect a stool specimen to confirm if indeed it is C-Diff, communicate with the patient and obtain consent to collect the stool specimen. Diagnosis of C. diff infection includes submitting a sample only of unformed stool. If the result indicates that the patient is positive for C. diff, adhere to the enteric precaution guidelines, such as hand washing with soap and water in conjunction with the use of gowns and gloves to reduce C. diff organisms on your hands. Explain and educate the patient and/or family about why the patient has been placed on isolation and the importance of hand washing with soap and water. Place the appropriate isolation poster on the door leading to the patient's room and urge all care providers and visitors to follow the enteric precaution guidelines. Place the poster on the alcohol sanitizer dispenser directing everyone to wash their hands with soap and water at all times. If possible, print out some educational material about C. diff infection that is easy to read and give to the patient and/or family. Collaborate with housekeeping to clean this particular room with a bleach solution until the patient is removed from isolation. Continue to monitor patient and provide care as needed. The patient. Unfortunately for the patient, Clostridium difficile, C. diff infection, affects every aspect of daily living. Decreases patient's energy level, makes patient feel really isolated and lonely, reduces appetite, patient too afraid to eat or drink in case of another rush to the bathroom or another call for a bedpan. The doctor. To-do list. Informed by the nurse about the patient's symptoms, orders for a stool specimen to identify the particular toxin produced by a bacterium. In the meantime, do a mental root cause analysis on this patient by investigating the following. 1. Look into antimicrobial usage. 2. Look into medication the patient is currently taking. Could it possibly be a reaction to the medication? 3. Look and see if patient is on proton pump inhibitors, such as Protonix. If the result indicates that the patient is positive of C. diff, adhere to the enteric precaution guidelines, such as hand washing with soap and water in conjunction with the use of gowns and gloves to reduce C. diff organisms on your hands. It is recommended to discontinue therapy with the provoking antimicrobial agents. Antimicrobial agents have been known to cause C. diff infection, but clindamycin and cephalosporins are most frequently implicated. It is recommended avoiding the use of antiperistaltic agents, as they may mask symptoms resulting in toxic megacolon. It is recommended vancomycin and/or metronidazole as drugs of choice for the treatment of C. diff infection. The patient appreciates hearing from his doctor why he has been placed on enteric precaution and how soon he can be taken off the isolation. Doctors continue to explore evidence-based practice in a quest to eradicate this debilitating illness. For example, the benefits of taking probiotics while on antibiotics and in some cases, fecal transplant. We are reading more and more about how effective it is. As care providers, we are all aware of healthcare costs being astronomical due to prolonged stay by patients having acquired hospital-associated infections. We all have a duty to stay vigilant and work together in the fight against infections. As can be imagined, C. diff infection is certainly no walk in the park.